Let's discuss Part 3 of Module 3 of Alterations of the Endocrine System. Oral hypoglycemics are absolutely useless in type 1 diabetes mellitus. Does anybody know why? Well, the reason is in type 1 diabetes mellitus, there is no beta cells to stimulate. Drug therapy for diabetes mellitus is provided in chart 67-3 starting on page 1423 of your textbook. We will go over a few of the medications, but a thorough description is provided for you in your textbook. You need to review this chart. Sulfonylurea agents stimulate beta cells to release insulin. Biguanides decrease liver glucose release and decrease cellular insulin resistance. Alpha-glucosidase inhibitors slow intestinal digestion and absorption of carbohydrates, which reduce glucose absorption. Thiazolide antidiabetic agents enhance insulin action. Then there is the use of combination agents. So when you discuss insulin medications, type 1 diabetes mellitus must have insulin. Type 2 diabetes mellitus may require insulin, but not necessarily. All insulin has the same basic action. What varies is the onset, peak, and duration. It is important to know so we can estimate the most likely time of insulin reaction. Table 67-9, Insulin Pharmacology, is provided on page 1431 of your textbook. You need to read to familiarize yourself in regards to whether it is a rapid, short, or intermediate or long-acting insulin. It is important to know the onset, peak, and duration of these insulins to aid in safe and effective administration. This is just a little image that gives you a brief overview of the insulin onset and peak. Okay, let's do a brief insulin review. Remember, insulin is given sub-Q only. Regular insulin can be given IV, but that is the only type of insulin that can be given IV. So when you give it sub-Q, you want to remember that the abdomen absorbs faster with more even absorption. Mixing provides longer coverage. Never mix Levemir and Lantus with any other insulins. An open bottle is good for 28 days in a cool, dry place outside of the refrigerator. Storage in cool place below 80 degrees. Never let it freeze or use if it did freeze. Administer at room temperature. Unopened bottles and pen syringes are good until the expiration date on the box or bottle if they are kept refrigerated. You want to match insulin concentration with the syringe calibration. And always double check your draw with another nurse. Some other things to remember are to roll the bottle to mix. You don't want to shake it. Always report to the oncoming shift the insulin that you have administered. You want to estimate your peak times and be prepared. You want to pinch the skin when injecting and inject at a 90-degree angle. You want to make sure to rotate sites to prevent lipodystrophy. When mixing the insulins, you want to make sure you draw up the clear first. Remember, it's clear to partly cloudy. You want to make sure you check your expiration dates before administration. And you want to check for settling or frosting. You want to remember dosages may need to be adjusted for exercise, illness, stress, or surgery. You want to have them repeat demonstrations to make sure that they're efficient in administering their own injections. You want to look for problems with self-administration. You want to make sure you're going slow with the education at the individual's pace. And then you want to make sure to teach them that you want to refrigerate insulin that is not in use. Here's a brief image that is just kind of helping you remember that when you're drawing up or mixing insulins, you want to draw the clear before the cloudy. There are other methods besides an insulin syringe to administer insulin. There is an insulin pump and the use of insulin pens. Please watch the video that demonstrates the use of an insulin pen. One complication of insulin is hypoglycemia. Treatment would include an instant glucose, either buccal or IV if the patient's unconscious. If they are conscious, you want to provide a carbohydrate plus a protein. This could be orange juice, crackers, peanut butter, cheese. Other complications are lipoatrophy, which is damage to tissues that causes impaired insulin absorption, and lipohypertrophy, which is skin thickening. To prevent this, you may rotate sites, and you can use a chart to do this. Also in the hospital, use different sites, and the sites you will use are the ones that the patient can't reach. This is the end of Part 3 of Module 3 of Alterations of the Endocrine System. Please be sure to continue with Part 4.